Welcome to St. Alphonsus Willcast, the podcast where we explore the many facets of health and well-being. This podcast is brought to you by St. Alphonsus Corporate Health and Wellbeing and a generous grant from the St. Alphonsus Foundation. Thanks for listening and enjoy the show.
Hello and welcome to the St. Alphonsus Wellcast. This is Kim Kleaveland. I'm a family nurse practitioner with the St. Alphonsus Corporate Health and Wellbeing Department. Today we are continuing our series with the Brain Health Program with St. Alphonsus. We've had several guests at this point, and we've sort of ranged the topics of different types of dementia and cognitive impairment, things you can do in supporting your loved ones. And today we're going to continue that conversation with Marissa Click. Marissa is a board-certified chaplain, and she works with St. Alphonsus in the Brain Health Memory Center program, providing support to individuals and their families. She also has a background in hospice and is very well versed in all things end of life. So we will be talking today about advanced directives, advanced care planning, and the different types of documents that you may need to know about. So this will be a two-part series, and the first is right now where we will discuss the different types of documents and give a cursory overview of those before our next episode when we'll dive in a little bit deeper. Thanks for coming on, Marissa.
Yeah, thanks for having me.
Yeah, how's it going today?
It's going great. I'm really passionate about helping people navigate their wishes. And so some of the hope or the dreams about coming on today was just, we hear a lot of misconceptions and a lot of people don't really understand all of these documents and how to fill them out and who needs to help and where to put them. So my hope is, we can educate the community and give them some resources, because it can be kind of overwhelming and scary, especially if you're being asked to have these really deep and meaningful conversations at a time when your stress and your anxiety is really high because you're in a health crisis.
Right.
A lot of times we get these requests to fill these out when people are in the hospital, when they're having a health emergency or a really big change in condition. And so the hope is if we can get people talking about these things sooner and more often with their families, with their primary care doctors, it will just make things so much smoother when they do end up in a crisis, because we all will, right? At some point, we'll all have a health change.
Oh, 100%. And, I think you're hitting it, the advanced directive part of it, right? Like planning in advance, having an idea of how you want things to go before everything is going downhill and spiraling. So, so important to have these conversations with those that are close to us as well.
Yeah. So I thought for this first one, we'll just kind of talk about the different documents and what they mean just a little bit. And for our next one, the hope would be we'll really dive in deep and help people think through some of the questions they might want to ask themselves as they work through those documents.
Wonderful. So which one should we start with?
So I think let's start with the differences between advanced directives and post forms.
Okay.
So an advanced directive is a document that allows someone to write down their goals, their values, and their preferences for future healthcare decisions. And it also lets them stipulate who they would want to communicate their care decisions on their behalf if they were unable to communicate for themselves.
Right.
And so This document, the advanced directive, is really for those future scenarios that we might be in. And the document also, again, allows you to choose somebody. Sometimes we don't always think about, that we're going to be in a situation where we might not be able to participate in our care. And that doesn't always mean it's a traumatic issue like a car accident or something major like that, but especially, folks who have dementia with progressive illnesses where cognitively they might not be able to make their own decisions. It can be really important to know what their preferences are, what their values are, who they are as a person, so that can be the guide for the medical decisions.
Right.
You know, a lot of times in medical care, we want to do everything. We want to fix things. We want to make people better, right?
Mm-hmm.
Most of us who get into the healthcare industry, that's like our hope and our goal. That's kind of what makes our heart beat.
Mm-hmm.
But, you know, there comes a time when we can't fix it anymore, right? Or there are treatments that aren't really going to solve the problem, right? They might help with some symptoms. They might help you have a better quality to your life, but ultimately there comes a point for all of us. I don't know about you, but I've never met anybody that gets out of this world alive.
So true.
Yeah. And so, you know, the advance directive is really a way for people to have their personhood honored when they get into that scenario where they might not be themselves anymore, where they might not be able to participate in their care anymore or make decisions for themselves. It's a way for their voice to still have value and impact, and for them to still have some form of agency at a time when they probably won't.
Yeah, and as you're saying these things, something that's coming to mind is in my background in primary care, having a lot of individuals, particularly older adults, because usually they've, you know, people in that age category maybe have given it more thought than people in a younger age category.
Very normal.
Yeah, but a lot of times I would hear, oh, I have a will. Or, oh, I have, you know, it's written down somewhere, but they don't necessarily have a person who's dedicated to be the person making their decisions for them in the event that they cannot. And, you know, the considerations initially coming to mind are, you know, who's going to know where that document is? You know, how does that stand up in terms of, particularly if you have requests to not do any life-sustaining treatments and things like that? Like, what does that look like? And can you just tell me a little bit about the benefits of having a person that you're using as your surrogate?
Yes, I sure can. So in the state of Idaho, if you haven't named someone specific that you want to be your decision maker, there is actually a law in place that talks about who would kind of be that default person. And it's under Section 39-4504 of the Idaho State Legislature, if anyone's really wanting to dive deep into this and know the laws. And so, again, this is just for the state of Idaho because every state has their own kind of laws about these statutes and how they work. It's the same with the documents. Every document's a little bit different compared to what state you're in. And so in Idaho, if someone has not completed that portion of their advance directive that indicates who they want to be their healthcare decision maker, it can also be known as their surrogate decision maker or your medical power of attorney. All of these terms are kind of interchangeable, so to speak. And so if that's not been decided, then the order that the Idaho State Legislature says that they're going to choose who speaks on behalf of that person if they can't speak for themselves. It goes court-appointed guardian. So in some cases where somebody has lost their capacity, their ability to make healthcare decisions on their behalf, and there's not any other family or friends who are willing to fulfill that role, often what happens then is they are helped along with the aid of social workers usually to kind of have a formal guardianship put on them by the court.
Okay.
And so that guardian then is the one who's going to start navigating their care, and not just health care, but where they're going to live and their finances so that they can pay for all of these things, right? Because unfortunately, you know, healthcare costs money and living costs money. And so that would be the first one, right? And so if somebody doesn't have a court-appointed guardian, if no one's willing to step up, you know, that might be the route that, you know, the healthcare agency in which they're in would choose to go to find a decision maker. So if they don't have a court-appointed guardian, the next person would be their legally married spouse or partner.
Okay.
And I say legally married, and I have to hit this point pretty hard because in our state there is not common law marriage that's not upheld. And so people often will come in and, you know, they've been together for decades, living together, making their lives together, in everything but that piece of paper document. They're married. But in our state, that doesn't count, which is really hard because if that's your person,
right,
if they know intimately about you,
and
especially,
your wishes and
right. Yeah. And if you've been estranged from the rest of your family or don't have as intimate of a relationship with other people in your lives, in your life, then, you know, that might be really difficult to hear as that person's spouse, that they don't get to make those decisions, especially if they're in conflict with a family member who is then going to be the decision maker.
Right.
So yeah, it's definitely a legally married status. So just a reminder, if this is your person and it's important, take the time to go get married. And
Make
I get
legal. Yeah.
make it legal if that's important, or write down in your advance directive that
Right.
this is the person that you want to speak for you. There's no time like the present to get stuff taken care of because we never know when something's going to happen.
That is so true.
Okay, and so if there's not a court-appointed guardian, there's not a legally married spouse, then it would go to an adult child. An adult here means 18 years of age or older. If there are multiple children, they would kind of be in a combined co-decision-making kind of status. If there's not an adult child, then it would be a parent if the parent is still living. If there's not a parent, then it would be any relative of the person that is appropriate and agrees to be in that role as healthcare decision-maker. And then after that, if there's absolutely no family, then it could be any other competent adult who agrees to fulfill the role and is not employed by or providing care to the person in any medical setting associated with their care.
Gotcha.
Right.
Now, does that person, any person who's willing, is this someone who knows the individual or?
Yeah, so we would definitely recommend somebody who knows the individual, right? Because they're going to have to make some pretty big decisions on that person's behalf.
Right.
And knowing them is pretty important to make those decisions. And knowing, you know, what their values are, what their preferences are, you know, if these treatment options that are being decided on are going to align with who that person is as a person. And so, we definitely want somebody who knows them to some degree.
Right.
But there are times when there isn't anybody. And so that's why, you know, typically if we find that scenario, especially where we have, you know, we often refer to them as adult orphans, but folks who have just journeyed through life and they've mostly been alone, you know, we'd probably recommend, you know, find a friend that's willing to be in this role.
Right.
Or, you know, again, there's always the support and the ability to get a court-appointed guardian, and social workers can usually help with that stuff.
Right. Yeah, all very important points. So going through that cursory glance of the options, this is the default, right? So we've gone through what will happen if there's no document in place or it's unclear what the wishes of the individual are, and that's the hierarchy of the continuum of decision-making that will occur. So the two other documents that we're planning on talking about, including that advance directive and the post form, in the advance directive, primarily individuals are appointing that individual within that form. Is that correct?
Yeah, so there's two parts to that advance directive. There's the appointment of your medical power of attorney or your healthcare decision maker or your surrogate decision maker. These terms, again, are kind of interchangeable. And then the other part is the living will part.
Okay.
And that's where you would write down your preferences and your values in those specific future healthcare scenarios.
Right.
And we'll get into more details on that in part 2.
Great. That sounds great. But it's good to know that there are two different parts to that form. One involves the individual, and then one gives some guidance for that individual and your healthcare team in terms of what your options are. And also, just one last question about the advance directive. If you're appointing an individual to make those decisions for you, does that individual have to sign off on this? Or is this just something that maybe someone designates somebody and then that person finds out at the time of need that they've been appointed.
Yeah, so we definitely encourage folks to talk with the person that they would like to be their healthcare agent. They do have to agree to be in that role.
Okay.
And it's helpful to know for them
Mm-hmm.
that they are going to be in this
Right.
role. You know, as you go through that living will section where you're putting down your preferences and your values and those medical decisions that you would make in those future
Mm-hmm.
scenarios. If I'm in that role as a healthcare agent, I want to know kind of what those decisions are for you and maybe even why.
Mm-hmm.
Not as a means to question your decisions,
Mm-hmm.
but just to know more fully so
Mm-hmm.
that when the medical team comes to me as
Mm-hmm.
the agent, I have a better background and a better understanding in how to be your voice.
Mm-hmm.
And so, you know, in that section where you name a healthcare agent, you have like a primary person, but you can
Mm-hmm.
also put backups,
Mm-hmm.
right? And so if, you know, for whatever scenario occurs for you and your health, you know, if there's a scenario that somebody that you've decided to be your healthcare agent has said, oh, I don't think I can make these decisions, or I can't be in this role,
Mm-hmm.
it's too much, it could go to the next person and the next person, the alternates.
That's great. That's a great process to know about. So let's talk a little bit then about the post form.
Yeah, so a post form it actually stands for physician order for scope of treatment. And so this is actually a medical order, a doctor's order that follows you out into the world.
Mm-hmm.
And so this document is for right now. You know, we were saying advanced directives are for the future scenarios you
Mm-hmm.
may be in. Post forms are for your health decisions right now.
Mm-hmm.
And so they have similar items in terms of healthcare decisions.
Mm-hmm.
You know, they'll talk about things like, would you want to receive CPR, or would you want to be intubated?
Mm-hmm.
Would you want to have artificial nutrition and hydration? But again, the difference is advanced directives are for the future, post forms are for right now.
Yeah, I'm hearing post form, which is funny because I'm from Oregon and there are post forms there.
Yes.
Which are physician orders for life-sustaining treatment, which are a different thing or similar.
Yeah, they're basically the same document.
Yep.
They're just a little bit different names, right? So
Yep.
I don't remember which state, but they call them most forms.
Okay.
Yeah, so it depends on which state you're in,
Yeah.
what exact term they use. And there might be some slight differences in the documentation. But for the most part, they're asking similar questions.
Yep.
And the post or the pulsed or the most, they, again, are all doctor's orders.
Right.
And so what's really important about this is, you know, if you are at home and something happens, right? We're all trained from a very young age.
Mm-hmm.
You call 911, EMS comes,
Yeah.
right? And so if it's important to you, if you've decided, you know, maybe I'm not seeking any more medical treatment for my illness, or there aren't treatment options available to me that
Mm-hmm.
would provide a cure. If you've decided I don't want to keep going back and forth to the hospital anymore, and you have a lot of chronic health issues, it might be a good time to talk to your doctor about filling out a post because in our country, the default is we're going to do everything. Yeah, it's called full code, right? So if your heart or your breathing were to stop, the default here is we're going to do everything to try to bring you back or to save your life.
Right.
And so what the post form does is, you know, if somebody gets scared, which is a totally normal and natural response to a health crisis, again, that default training kicks in and we call for EMS. And when EMS comes, if they don't have a doctor's order there where they find you, their default's going to do everything. Right. And so the post form is really, if those things are important to you, to not come back to the hospital, or you're a do not resuscitate, you don't want to be intubated, all of those things, it gives the ability for EMS to say, okay, we're not going to do all of the things we would do under normal circumstances to save somebody's life or to bring them back from the dead. because we have this doctor's order saying,
right, not to do so.
Don't do these things, right?
And they're generally a pretty bright color, and I think if I'm remembering, the instruction is to put them like on the refrigerator or somewhere really visible in the home. Is that?
Yeah, they used to have to be on a salmon colored paper,
Okay,
right? So they were really bright, like this highlighter color to grab
right.
attention. That's not a requirement anymore, but it's always, I mean, you can print it on whatever paper you want.
Gotcha.
Is it helpful? Sure, because it's eye-catching, right?
Right.
But sometimes they're just on white paper. But yeah, it is recommended that those things live, by the front door or on the fridge. I hear from most folks the fridge is a good place because I think sometimes that can be kind of revealing if you have people come over and it's like, whoa, this big post form is just the first thing that you see when you walk into someone's home.
For sure.
And if you don't want to share your health information, which again is totally understandable and acceptable,
right.
Yeah, you might not want to put it right at your front door, but definitely within reach, not shoved into all of your paperwork that's in the safe in the back room.
Oh, so true. Okay, and so we're going to delve so much deeper in our next episode into all these different considerations regarding these forms. But the one question I have regarding both of these forms is, do they cross state lines? So if you're from Idaho and maybe visiting family members in California or Oregon or New York or wherever, do these things stand up throughout all the different states you may visit?
Yeah, so most states will honor each other's advanced care planning documents. It's pretty common.
Okay.
If you're planning on moving, it's best to fill one out for the state in which you reside. But again, they'll usually be honored depending on where you go. I know here in Idaho, the Department of Health and Welfare this year just took over advanced directives. And so they actually have a database now where you can, in a safe and secure location, store that document electronically.
Oh, okay.
So that can be really helpful if you're a big world traveler or you go out of town a lot. Most people don't think about like on their packing list to bring their advanced care planning documents.
Right.
But it can be helpful to have because, again, we don't know when an emergency might happen or when an accident might happen. And so having access to these documents in a quick and easy format can be really helpful. And one way to do that is to put it in the Department of Health and Welfare's registry.
Well, great. Well, thank you so much for that insight. Okay, so this concludes our first episode where we're talking about advanced directives versus post forms and the general characteristics of each. And then we hope you'll tune into the next episode where we'll delve in a little bit deeper to all the different types of forms and the considerations when completing all of your advanced care planning documents. Thank you so much for coming on, Marissa.
Yeah, thanks for having me.
Okay, have a great day.
Thank you for listening to this episode of St. Alphonsus Wellcast, brought to you by St. Alphonsus Corporate Health and Wellbeing and the St. Alphonsus Foundation. Always be sure to catch new episodes by subscribing to us through all major podcast platforms, including Apple, Google, and Spotify. We hope you'll tune in again. Until then, be well.